As part of this week's reading, I included an article that gives you a synopsis of the performance of each hospital in the country. You can also go on to Medicare's Compare websites and look at the performance for any hospital you want in the country. In addition, you can look at nursing homes, home health agencies, and a whole bunch of other different types of providers. The next couple of slides will do a detailed analysis of what's available on Hospital Compare. This is a snapshot of the homepage of Hospital Compare. Please type in a zip code or search for your hospital that you're interested in reviewing by name on the homepage. I chose a hospital in my hometown, Loyola Gottlieb Memorial Hospital. Take note of the information you see here on the very front page. You see the overall stars ratings for Loyola Hospital. This hospital is 4 out of 5 stars across the ranking for all quality metrics that Medicare uses. It shows you the distance from the zip code that I entered, whether or not emergency services are available, and maybe most importantly of all, the type of hospital Loyola is. In this case, it's an acute care hospital. The Medicare program actually recognizes 7 unique different types of hospitals. So this is an important factor that beneficiaries need to see. They may not know what an acute care hospital means. That's why the link is available for you to click on it and get some more information. Once you have selected the hospital that you want to review, you get a bunch of different tabs with detailed information in specific areas for the hospital. On the first tab for general information, you see the address, the phone number, and some of the other factors that we saw on the last slide. In addition, you see some other factors, such as whether or not the hospital uses a safe surgery checklist and whether or not they have a culture on patient safety. The next tab to review is the patient experience aspects. As you can see from this, there is a comparison of Loyola as an individual hospital compared to the Illinois average compared to the national average. On the composite of the patient experience measure, Loyola Hospital received 3 out of 5 stars. The measures that make up the composite star rating are included below. The first one, patients who reported that their nurses always communicated well, ranks Loyola at 78%, whereas the Illinois average is 81 and the national average is also 81. So on this particular metric, Loyola performs worse than the average hospital in Illinois and in the country. Hospital Compare includes quality metrics for the timeliness of care delivered. On the left-hand side is a list of timeliness factors by disease state. So you can look at the hospital's performance in each of these specific categories. The category I chose to the right is use of medical imaging. On this particular measure, outpatients with low back pain who had an MRI without trying recommended treatments, Loyola Hospital ranks 36%, as compared to the Illinois average, which is 38.4%, and the national average, which is 38.7%. In the case of this measure, the lower the number, the better the performance, which is the opposite of what we saw for the measure before on the previous slide. Imagine how confusing this could be for a consumer. In some cases, positive measure performance is associated with the higher score, but in other cases, positive measure performance could be associated with the lower score. There's not a consistency from measure to measure. and the way CMS uses this program and publicly reports it. Take a minute to go into D2L and think about the impact that this may have on the individual consumer. Hospital Compare uses metrics associated with adverse admissions or readmissions to a facility. You're able to pick a readmission rate for your hospital of interest, which in this case is Loyola, based on different procedures. In this case, I chose the rate of readmission after a hip and knee replacement. Loyola performs, quote, no different than the national rate, end quote, the national rate being 4%. The reason that we don't see a percentage in the Loyola box is because this metric is used in a very different way than some of the other metrics we've already looked at. The performance is compared to the national rate, and Hospital Compare only reports if you're better, worse, or no different than the national rate. Hospital Compare also includes a measurement of psychiatric services that are available to patients. In this case, for the first measure looked at, patients discharged on antipsychotic medications who had a BMI, blood pressure, blood sugar, or cholesterol screening in the past year as a process of care measure. Loyola's performance is 93% as compared to the Illinois average of 69% and the national average of 65%. In this case, Loyola is a much better performer than the vast majority of its peers on both the state and national level. The last category on Hospital Compare is payment information for the hospital. There's also a component of value that CMS includes on Hospital Compare. In this category, we're looking at Professor Grabert's favorite measure, the Medicare spending per beneficiary measure. And this measure is viewed as a ratio. As we saw in the example from the previous module, the national average is set at 0.99. So the ratio of a hospital that's higher means it's more expensive. A ratio of lower than 0.99 means it's less expensive. In this case, Loyola performs at 1.04, meaning it is more expensive on average for each patient it treats as compared to the Illinois and national average for all hospitals. Please take the time to go into Hospital Compare or another Compare website of your choice, nursing home, home health, so on and so forth, to compare facilities in a geographic area of interest to you. Then go on to D2L and blog about your experiences with it. What did you really like about it? What did you not like about it? How do you think about these Compare tools as something that can empower patients in the healthcare system? Is this something that patients would find confusing, or is it intuitive and could help guide their decision-making process? In addition, compare facilities. So look at the aspects of performance on these metrics across several different providers of the same type. Is this the type of information you could see yourself using as a consumer to help guide some decisions that you need to make? Also think about the implications of how you would use this information in an emergency versus a non-emergency situation. In a non-emergency situation, you have time to extensively plan and research the healthcare services you might consume in advance. In an emergency situation, you don't have that same luxury. Think about the impact of these tools and the different type of situation you may find yourself in as a consumer.